If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. What a pleasure it was to speak with Deonta Wortham, Chief of Staff and Head of Strategy at rockhealth.org, where he leads the strategic direction and integration of rockhealth.org's impact and organizational activities in collaboration with the organization's CEO, board, initiative leads, and team members. Deonta previously held portfolio investing, advisory, and field leadership positions at New Profit, a national venture philanthropy fund, academic research, and accelerator management positions at Emory University's Business School. He has also served as a feature contributor to Plus Acumen, has published research in the Stanford Social Innovation Review, was a 2022 Aspen Ideas Fellow, and is an advisory committee member to Impala, a nonprofit intelligence platform. Let's get started. Today, I'm really excited about digging in deep with you.
Yep.
Thank you for joining the podcast today.
Thank you. I'm so happy to be here.
So, a lot of us in the digital health ecosystem are pretty familiar with the early stage seed fund of Rock Health and the work that's done there, but not so much about the work of rockhealth.org.
Mm-hmm.
Can you break down for us what is rockhealth.org and where it sits in the ecosystem?
Yeah, it's a really great question. And to your point, yeah, we are associated with Rock Health overall, which has a nearly decade-long history of building both organizations and supporting leaders and convening actors across the digital health space. And where we are one entity under the broader Rock Health umbrella. Rockhealth.org is an independent 501c3 nonprofit that, alongside our affiliated organizations, Rock Health Advisory and Rock Health Capital, which you just mentioned, works to make healthcare massively better for every human being. And we think that that's possible through the intersection of health and technology. I would say that rockhealth.org specifically is thinking about how we can equip innovators within digital health. Think founders, investors, corporate leaders, etc., with resources, reach opportunities, and the recognition that's needed to create an equitable future within digital health for everyone. And we're doing this by fostering ideas among folks within the digital health space. We're doing this by convening actors to have thought-provoking dialogues around what's necessary to ensure that equitable principles are centered within digital health. And we're also doing really intentional work to make sure that connections are made across the space among leaders who are developing strong solutions for multiple communities across the broader population, but are specifically doing that by leveraging digital health innovations. I would say one of the things that we're also really, really excited to explore through our work is who are the folks that are developing digital health solutions, and then most importantly also, who are those innovations reaching?
Awesome. I'm going to dig in there a little bit. You said something about equipping innovators with resources and reach and recognition to create an equitable digital health future for all.
Yep.
What does it mean to try and embed equitable principles within digital health?
That is the core of our work, and it's a really exciting question. The essence of that question, I think, really is how do we ensure that this field, which is digital health, is thinking about serving more people in more effective, powerful, and impactful ways? And then also, how do we think about ensuring that both builders within organizations, investors within investing context, corporate leaders within their respective environments, are building large tables where they can constantly ask the question of who is contributing to and who is benefiting from digital health innovations. And that spans all the way from how do we identify problems that are being solved by digital health technologies? How do we think about what are the components that are necessary to develop impactful solutions that reach and meet the needs of diverse audiences? And also, how do we think about assessing the impact of those solutions? One of the things that I also love that our team did back in 2021 is publish a piece that's called Building Towards Equity. And that piece explicitly names four broad principles that are necessary to center equity within digital health. And those include finding ways to center in the needs and the understandings of communities and population groups that you're solving for. It involves thinking about how do you co-design digital health solutions with folks that will be on the receiving end of them. How do you know that you're using the right technological approaches to engage and have consistent engagement with digital health users? And also, how do you make sure that folks understand the technology and understand its power and impact in accessible ways? And we think that those four principles can be applied to a number of things. It can be applied to how you are thinking about identifying powerful folks to invest in and how they are answering and considering those four principles. It can be applied to folks that are developing solutions and are thinking about how do we actually understand the needs of our end users in powerful ways. And then also, how do you think about assessing the quality of those solutions as well?
It's really powerful. I think, I'm in complete agreement with that approach. Obviously, it's the work that we're also doing here at Digital Health Review.
Mhm.
And, the impact really is who is at the table.
That's
And
right.
not just who's at the table, but what is their mindset at the table? Are they just building a digital health company because they have a problem, they have domain expertise? Are they just pure profit minded? Making sure that the mindset is correct, and then the enablement of them, right? So who's at the table, what is their mindset, and if we can make sure that those at the table have the right mindset, then how can we make sure those types of people and their projects are enabled to actually become actualized out in the market, because those solutions deserve to win, because they are, like you said, centered in the community. They're co-designing the solution with the community or the population. They're developing the right tech for it and making sure that it's accessible, which is a big issue in healthcare. When you consider the investments in particular, how is rockhealth.org creating initiatives, or what sort of ethos is rockhealth.org creating it, working with when you're thinking about investment initiatives? How are you tackling that work?
It's an exciting question. And one of the things that our organization's work has been centered in, like I said before, is asking two questions. Who is developing digital health innovations, and who are those innovations reaching? One of the things that we've been thinking about a lot is that if digital health is really aspiring to live into its promise and potential and truly wants to transform the lives of all, then we need to make sure that there is the broadest array of innovators that are developing solutions in this space and are developing those solutions by deeply understanding what are the health needs of the broadest array of end users of digital health products. We earlier this year launched an initiative that has explicitly been focused on how do we think about broadening the innovator profile within digital health. And we've done that through what we've called the Equitable Investments Initiative, which has the explicit focus of supporting and amplifying the work of underrepresented and underfunded innovators within the digital health space and catalyzing greater investment in those leaders. And the initiative is working with a broad array of actors to do this, These are folks that are building organizations themselves. They're venture investors. They're folks that are working with impact-oriented funds. They're folks that have advisory backgrounds. There's even a few physicians that are in the mix, and we love our providers because of the brilliant expertise that they bring, and also folks that are working in tech contexts, whether in the corporate setting or in other settings. And they all came together with the rockhealth.org to think about how do we increase the flow of investment resources to underfunded and underrepresented innovators within this space. And what we did with those folks and what we continue to do is to say, what are the major challenges that underrepresented and underfunded innovators are facing when they're scaling their companies? How do they not only think about getting the capital that they need to grow their companies, but how do they think about getting the strategic support and the insights that are necessary to build organizations in sustainable ways? How are they also engaging with networks across this space to ensure that they have the broadest array of connections and also insights that can ensure that their innovations reach the communities that they need to reach? But then secondly, that they can also engage with the broadest array of folks that are doing great work within this specific context, within this specific industry. And one of the things that I wanted to note is that we're thinking about underrepresented and underfunded founders right now, specifically as innovators that come from communities of color and innovators that identify as women plus. And we have focused on both of those groups because through earlier research that Rock Health did back in 2020, we noted that innovators of color within digital health and women plus innovators were undercapitalized in this space. But we know that for digital health to truly engage, truly impact the lives of all, we need folks that are coming from those backgrounds to build powerful solutions that address the health needs of women plus end users, and then also can build product solutions and understand the unique challenges that folks from diverse communities across the nation and the world face as well.
I love the framework that you're building under. One thing that I've noticed in my work as well is that there are a lot of underrepresented and underfunded founders wanting to build companies in the digital health ecosystem, and they may not have that network. They may not have traditional training or a career in healthcare.
Mhm.
And as we all know, healthcare is very complex.
Yes.
And what I see often happening is sometimes they could be starting on the wrong foot unintentionally because they're not surrounded by a network that can bring them up in that way and keep the purpose or the vision of their company
That's
in
right.
an equitable mindset,
That's right.
and supporting them with all the components of that framework that you were just describing. And so that's one of my greatest fears also as underrepresented founder also in the space is in trying to help other founders is that it's very hard to one, construct that network, and to maximize and utilize it. So when Rock Health is thinking about these types of founders, what does it mean to support a community of digital health founders for Rock Health? What does that look like?
Yeah, I really appreciate the playback that you just did there, and I'm going to answer your question really quickly, but I do want to know something that you said that I found so powerful and has been a core premise that we've centered in our work, is that we intentionally use the phrase, how can we support underfunded and underrepresented founders by ensuring that they have greater access to investment resources, as opposed to saying investment capital. Because oftentimes when people are thinking about ways to support founders, they narrow in on like, how can we get capital to underrepresented founders such that they can scale their businesses? And one of the things that we've discussed with our team and with folks within our community is that venture capital, other growth-oriented capital is one variable in a multifaceted equation that's necessary for a founder to succeed. If we're not thinking about what's the strategic support that they need to grow their organizations, and to your point also, how do we ensure that they have access to networks that can sustain and pour into those entrepreneurs on an ongoing basis, then we're actually not actually addressing the holistic needs of the entrepreneur themselves. And finding a way to ensure that we're putting an equal focus on investment capital, on strategic support, and then also on developing and nurturing and introducing entrepreneurs to dynamic networks, then we're not doing our job, quite frankly. And we're not also ensuring that any founder, but particularly founders that come from underrepresented and underfunded backgrounds, are starting off on the right foot, and most importantly, are running as fast as they can. Um, to your point around what are we doing to build and to support a community of digital health founders, I mean, this is where I get really, really excited, because it's in many ways the essence of what we do at rockhealth.org. Like I said before, we're really focused on how do we foster ideas, conversations, and connections among founders such that they can grow and grow as individuals, and also to ensure that they can grow by scaling their respective solutions. And when we're thinking about our role as really a tool and a companion to innovators in this space, there's a few things that we're thinking about. The first of which is that we want to make sure that we're standing shoulder to shoulder with leaders in this space. We want to make sure that they know that we understand how hard the the leadership journey is for founders within the digital health industry, but then also the guts that it takes to build a solution in what you described a few seconds ago as a really, really complex field. We all know that healthcare is a complex environment, and when you add the nuances of technology on top of that, you just set yourself up for what I call just like this really, really exciting mental experiment of how you can grow really, really powerful solutions in a really, really complex space. What we're doing to support leaders in our community is to think about ways that we can complement their learning by highlighting emerging insights and trends across the digital health industry. We're really focused on ensuring that we're amplifying the great ideas and ongoing work that the leaders themselves are doing and advancing within their own respective context. And this can include new approaches or new perspectives that they're lifting out of their work, or new ideas that they really want to be seated and embedded within digital health's broader ethos. And we're also ensuring that, like I said before, that digital health leaders can be connected with like-minded folks. And this is ensuring that they're connected into those dynamic networks, that they're in relationship with other leaders and innovators that are doing comparable work to them, and that they need to be aware of, or quite frankly, just need to have a chat with for a number of reasons, whether that's partnership, whether that's just ongoing learning, whether that's peer support, etc. We want to make sure that we're a one-stop shop that allows folks to know that we, quite frankly, have a broader view of the field, and that we can ensure that they're navigating the field in powerful ways and learning in powerful ways as well.
I love that. I love that. And, I think the right to win here is taking that framework of network model and applying it to healthcare.
Yeah,
Because as we all know, healthcare is just a network.
that's right.
It's a network of providers and people and systems
That's right.
working to ideally serve patients, other people. And just applying that on the other end is is exactly what we need. And so I love the support that you're building for digital health founders. And for all the founders that are listening, can you tell us how would someone want to or can engage with rockhealth.org if they agree with this model, if they're excited about it as well? How can they engage with you?
It's such a great question. We're excited for folks to engage with us from across the space. The clearest way to engage with us is by attending our marquee event, which we hold every September. We just held it a few weeks ago, which is Rock Health Summit, and that is an annual convening that brings together many of the brightest minds in the digital health space to think about what is going on in the field right now, what do those trends mean for what will happen in the future, um, And also, what are the real tactical things that leaders should be considering as they're thinking about navigating an evolving digital health landscape? Secondly, I would encourage folks to engage with emerging bodies of work that rockhealth.org is standing up right now. The Equitable Investments Initiative, which I lead, is right now engaging with a number of actors across the digital health space to really ask the question of how can we, in intentional ways, support the work of underrepresented and underfunded founders that come from communities of color, and folks that identify as women plus innovators. How can we engage and support those folks in powerful ways? And we have a number of opportunities to engage entrepreneurs that are interested in that work, and also folks that may be coming from investing environments and also other ecosystem building organizations as well. And then lastly, what I'd say is we want to hear from you too. So feel free to shoot us an email at hello@rockhealth.org, and we can find ways to both understand the work that you're doing, and then most importantly, find ways to ensure that we can be supportive and helpful for you.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.